One of the best parts of these conversations is I get to talk to thought leaders around the country. I get to have longer form discussions where, we discuss the things that are on your mind or on my mind. And with me today is a man who needs no introduction, Dr. Peter McCullough. Dr. McCullough, thank you for joining me.
Well, thanks for having me.
All right, Dr. McCullough, you have been at the forefront, as you know, of course, at the forefront of following the actual science, of questioning the public health establishment, of pushing back on claims by politicians that contradict the scientific studies here. And I'm so glad to talk to you today because I want to ask you, as a physician, as a doctor, over the course of the past 2 years, maybe even since January of 2020, what was the one moment or the first moment when you realized that something was wrong, that the public health establishment was not following the science and that politicians were misleading the American public in a big way?
The first hint that I had that happening was in April of 2020, when I noticed that once we got issues of personal protective equipment squared away at hospitals, I noticed that there was no initiative to open up treatment clinics or treatment centers. And I remember being on some town halls and some task force calls saying, listen, are we gonna treat this? If we don't treat it, patients are going to get sick at home and end up in the hospital. I said, listen, there's two bad outcomes, hospitalization and death. If everybody could get through it at home, that would be a victory. And to this day, we've had 2 presidential administrations, 2 White House task force, 2 surgeon generals. We haven't had a single official give a full-throated statement saying that they were going to put together a team to reduce hospitalization and death, that they were going to fully support doctors in doing everything they could to treat patients compassionately and take away the terror of COVID-19 causing hospitalization, isolation, and then sadly in patients in the hospital, some their demise, dying alone, in isolation.
Well, you're not alone in the fact that a lot of Americans notice that same thing. I mean, even today from the White House, meaning that now, currently, not necessarily today, but currently we see from the White House this narrative talking about testing, talking about cases, not so much talking about hospitalization and death. And people, I think, see the incongruity there. And I'm going to ask you a question that I actually hate when other people ask me, but I think it's important given what you're talking about. You initially got the COVID-19 vaccine, and actually you were not skeptical of it at the onset, correct?
No, that's actually incorrect. I think somehow that got started by Joe Rogan or Aaron Rodgers. I never took the COVID-19 vaccine because I was treating COVID patients and I knew I was taking risk. My wife and myself developed it very early in the pandemic. So I had COVID-19, I had respiratory involvement, and then I recovered. So I knew that, my case, I would not be eligible for the vaccines. The FDA and the vaccine manufacturers strictly excluded people like me from receiving the vaccines. And subsequently, there's been now 3 papers, Raw, Kramer, and Methodius, have all shown harm. When someone's COVID recovered and they take the vaccine, they can only be harmed. There's no benefit in someone like me taking the vaccine. No, so I didn't take the COVID-19 vaccines. I think what people misinterpreted is that I am pro-vaccine. I mean, I've taken all the other vaccines, all the evidence-based vaccines. My children did, my wife did. We traveled to India, we took extra vaccines. So I accept vaccines in the modicum of general, good clinical practice. The COVID-19 vaccines, though, as it evolved, as it turns out, there's great concerns over safety and now failed efficacy.
Well, this is very interesting because I did read headlines after your appearance on Joe Rogan saying that you got it or insinuating that you got it, even though you may not recommend it for other people. So what is this safety issue for people who have recovered from COVID-19? Any of the variants? Or what is the danger of taking the vaccine after you've recovered from any of the variants?
In these manuscripts, people had more high-grade immediate reactions, including reactions that landed them in the hospital. The body is, in a sense, once they've had COVID-19, the body is primed with the spike protein. We know the spike protein from the virus is now deposited in the body. It can stay there for over a year. And so if we install the lipid nanoparticles that contain the genetic code, and we actually, in a sense, harness the body's cellular machinery to produce more spike protein in an uncontrolled manner, the body's already primed and doesn't like this spike protein. It's trying to clear it out. And so now we're going to deposit another year's worth of spike protein with each shot. It's too much. Patients can't tolerate it. And, one of the things in the US CDC VAERS system, the Vaccine Adverse Event Reporting System, there's no checkbox to indicate whether or not someone's already had COVID-19 and received the vaccine. So the CDC would have no idea if patients who have already recovered from COVID, if they're actually harmed with the vaccines. We have to look at other sources of data outside the US.
So this is the pathogenic priming that people are talking about, correct?
It is, in a sense, it's a set of priming. The body is reacting to the spike protein. That's the whole idea of giving a vaccine, is to try to fight off that spike protein. And now we're going to basically install another round of spike protein. All those immunologic systems are revved up, and we know the spike protein itself damages the brain, damages the heart, blood vessels, causes blood clotting. There's been autopsy studies that show the vaccine goes everywhere in the body. It's in the brain, the heart, the bone marrow. And it is everything we've learned about the spike protein since the release of the vaccines is bad news in medicine.
So it makes someone more likely to suffer those adverse events, the spike protein damaging, whether it's the heart or whether it's an organ or whether it's the brain, if you've already recovered from the virus itself?
That's true. And it's a leading hypothesis of why some people may get myocarditis or heart inflammation. Maybe it's children who have already had COVID-19, for example. It's one of the theories about who gets a blood clot and who doesn't. And that is people who have either had clinical or subclinical COVID-19. So one of the things the CDC needed from the very beginning is they needed a registry of who's already had COVID, because we know that those individuals up through the Delta variant had very low risk of recurrent infections. In fact, we used to really rely on natural immunity. The Omicron variant has broken through natural immunity, and now it's really irrelevant. So with Omicron, whether someone's been vaccinated or naturally immune, the Omicron variant has, in a sense, shown the ability to reinfect. It's typically a very mild infection, self-limited.
Right. And I believe, if I'm not mistaken, it can reinfect both. It can break through natural immunity and vaccine-induced immunity. So nobody per se is safe from Omicron. Here's my question to you, though. Is there any cohort of people, and by this I mean, of course, high-risk people, is there any cohort that should take this particular vaccine or these vaccines for COVID-19 that we have? Anybody who's at high enough risk of COVID-19 that the risk from the vaccine is worth it?
You know, in an analysis by Kostoff and colleagues that was published in Toxicology Reports, he asked that question, said, is there any age group or comorbidity group where it's worth the risk of immediate death or injury with the vaccine in order to be protected against COVID-19? And Kostoff couldn't find a single group. Even at age 65, one is more likely to die of the vaccine than actually take their chances with COVID and die of the respiratory illness, partly because, we can treat COVID-19 now. We have many, many different treatments. As long as we get early treatment, we get people out of harm's way. But there's not a favorable trade-off. Now, of those who do take the vaccine, and they do survive, in a paper by Cohn and colleagues from the VA, over 700,000 veterans. That's a huge sample size. For those over age 65, there was a 12-point differential in survival. So the survival curves favoring vaccination. Now, we don't know if they died with or of COVID, but nevertheless, there is that favorable trend. But under age 65, there's only a 1% absolute difference. And most of the conversation in America is not about the seniors. It's about young people. When Joe Rogan saw that, his eyes got big as saucers and he shook his head. He goes, that's not a very big difference. And I said, no, that's what this is all about, is the idea that maybe younger people could benefit. Many have said that the benefit of vaccination is keeping people out of the hospital. I think all the hospitalization data at this point in time are basically contrived. And the reason why I say that is that there's differential use of testing, that non-vaccinated people have been subjected to far more tests than vaccinated. So we have this differential testing rate. And we have lots of people being tested that don't have respiratory illness. They have hip fractures or other conditions, nothing to do with the respiratory system. And we've learned in the last 2 weeks that anywhere from 40 to 60% of all these hospitalizations have nothing to do with COVID. They're basically just excess testing, whether they're false positive testing or patients in the pre-symptomatic, or they're basically on the back end of COVID-19. Once somebody has COVID-19, the tests are positive for months afterwards. A lot of people don't know this. The NIH autopsy study just came out. Chertow and colleagues is the first author, published in ResearchGate. They showed 44 people died of COVID. The virus was in the body at the time of death for a very long time after the initial infection. In fact, one person, the virus was alive and in the body for 230 days. So this viral infection is not a short-term thing. No wonder people test intermittently positive. No wonder people feel bad afterwards and they have long COVID syndrome. This is actually analogous to Lyme disease. where the bug, in a sense, doesn't install in the body and is there for quite some time.
It's really interesting. I mean, I'm stuck on that same statistic you mentioned before, because what we hear at this point, I mean, the CDC even admits that the COVID-19 vaccine doesn't stop you from contracting the virus. Walensky herself said what the vaccine can't do anymore is prevent transmission. So we're basically told at this point, well, it prevents you from suffering serious disease if and when you do contract it. It'll prevent you from being hospitalized, prevent you from dying. But if you're saying for people over the age of 65, it does, and it does by 12 points, it does reduce the chance of hospitalization and death. But anybody under 65, just 1%. I mean, that's really mind-blowing. That's very different than what we're hearing from the public health establishment.
That's in the published literature. I'm just giving the data. Now, there's another paper to look at by 1040 et al. From the Ivy Network, which is a very good research network. And I looked at people who were admitted, and it was pretty clear they had COVID. And being vaccinated was associated with a 59% reduction in the progression of disease in the hospital. That's favorable. But we look at mortality among those fully vaccinated in the 1040 paper. Mortality was between 6 and 7% for the fully vaccinated, and it was between 8 and 9% for the unvaccinated. And that was not statistically significant. So it's clear the vaccine doesn't protect everybody from dying in the hospital. There are some favorable effects of the vaccination, but it's very modest. It wouldn't be anything that would cause an employer to mandate COVID-19 vaccination. I still think the employers are mandating vaccines because they think they actually stop spread of the virus. And as you pointed out, that's been completely disproven. Now in a paper by Singarajam and colleagues in Lancet, 39% of all transmission is from fully vaccinated to fully vaccinated. So it's hopeless trying to have a fully vaccinated workforce. And administrators have learned that down at Houston Methodist Hospital, where they really wanted to purge the employee population of any unvaccinated. A lot of women who were frontline workers, they were pregnant, couldn't take the vaccines, they lost their jobs. They were humiliated in this Houston Methodist case. And now the Houston Methodist administrators have egg on their face when all the fully vaccinated workers are developing COVID-19.
It's terrible. I mean, it's terrible. A lot of people are impacted by this. A lot of employees. I mean, I've shared with the listeners to my show, the viewers of my show, that my husband lost his job over this vaccine mandate too. Go back to a very early study though, because I want to talk for a minute about the original data that came from Pfizer, their original 6-month study that I believe Fauci stopped 6 months into the study, that actually showed, if you look very closely, if you analyze these numbers very closely, it showed that there were more deaths in the vaccine group than there was in the non-vaccine group, and more deaths due to cardiac events in the vaccine group. Alex Berenson or Robert Kennedy Jr., they say this is very significant data, and that these cardiac events, just analyzing the data show that they are, because that there is not just correlation, there's causation between the vaccine and these events. Is that a correct analysis?
Yeah, you're pointing to the only source of randomized data. We randomize to the vaccine or placebo. That's our only clean look at what's going on. In the original briefing booklet submitted by Pfizer for the adult program, there was no reduction in hospitalization and death, none. There was just a numerical reduction in the binary endpoint of COVID-19 mild respiratory illness, literally like trying to prevent a cold at home. And it was less than 1% in both the placebo and the active treatment group. So the original 2-month trial was unimpressive. But when Pfizer came around next year and looked for boosters and pediatric extensions, the briefing booklet was supplemented with 6 months follow-up data. And it's exactly what you said. Now there's more deaths that have occurred with Pfizer than there has with placebo. And that's the only randomized data we have. And so lead attorney Aaron Seery has assembled a panel of public health professionals, 30 of them. I'm the lead. I'm the captain of the team. And he's pressed the FDA and Pfizer to release their dossier. Pfizer's got 400,000 pages of safety data. And so originally the FDA, their attorney approached the judge and said, we want to release it in 55 years. Well, I can tell you, I'm 59 now. I'm not going to live 55 years to be the captain of the committee. And America at that point in time knew that there was a transparency issue. Everyone should realize that 55 years to keep data hidden from the U.S. public, I mean, that is an outrage. So Seery really pressed the courts and now has this coming out over about 8 months or so. What we want to do is we want to see actually why people are dying after the vaccine. And even in the first pages that were leaked from Pfizer, Pfizer knew about thousands of deaths early on in the vaccine program. And I want to direct the team to analyze these deaths and figure out, were they dying of blood clots, heart attacks, neurologic injuries, acute hypertensive urgencies, myocarditis, were they dying of immunologic problems or hematologic problems like vaccine-induced thrombocytopenia? The data will actually be in their dossier. We have to figure out why such large numbers of people are dying after the vaccines. We know from two analyses, one by Rose and one by McLachlan, that were published earlier this year, that about 50% of the deaths occur within 48 hours, that 80% occur within a week. So they're very tightly related. We know it's possible to die because the vaccines use a new mechanism of action where the genetic code is installed for the dangerous spike protein. You can imagine someone takes up too much of the code or in the wrong part of the body, the spike protein just ravages that organ and develops a fatal syndrome. So the biologic plausibility is there. It's been internally consistent with other non-fatal events like heart attacks, myocarditis, blood clots, fetal loss, Bell's palsy, cervical myelitis, Guillain-Barré syndrome. It's externally consistent with the yellow card system and the UDRA system in Europe. So what I've described for you is that basically the death pattern, the fact pattern, has fulfilled the Bradford Hill criteria for causality. I can tell you, I'm a trained epidemiologist. I'm in clinical practice half the time. I'm in research as an author and an editor the other half of the time. I have over 650 publications in the peer-reviewed literature, over 50 in COVID-19. I've looked at so much data. I can tell America clearly that a large fraction of these deaths are directly due to the vaccine. It is without a doubt. In fact, McLachlan analyzed the vignettes that were available in April in the VAERS system and had independent coders review them. They concluded 86% of the time there was no other explanation outside the person took the shot and they died a few days later.
Did Pfizer or does Pfizer know this? Do they know this and they're hiding this, or their data is just so convoluted and they don't care? What's the explanation? What's the explanation there relating to Pfizer?
Pfizer's had meetings with the FDA in September and October, and there's been external presenters there. David Wiseman, Steve Kirsch, Peter Doshi. There's been external presenters there. All these insights have been presented to Pfizer and the FDA, and they haven't been disputed. So they have not been disputed. Those stakeholders are basically holding the line and saying, no matter what, people must take the vaccine. In fact, Dr. Rubin, at the most recent pediatric meeting, he's on the external advisory panel. He's the editor of New England Journal of Medicine. In the end, he said very cavalierly, he said, the only way if we're going to know they're safe in small children is to just try it out. Just vaccinate all the small children. And I can tell you, I'm an editor of a major journal too. I'm a senior physician in medicine. I think that's irresponsible. It's reprehensible. It's deplorable. It's just reckless for the country that we're going to try out this vaccine that has no possibility of benefiting these small children and a great possibility of harm, and then pick up the pieces afterwards. America should be outraged.
Well, I think it's hard for some people, and I'm not pointing the finger in blame. It's just hard for some people to believe this extent that there exists corruption to this extent, that there's a pharmaceutical company that colludes, big pharma that colludes with big government, that is so reckless and is so just doesn't care at all, is so heartless about people dying, especially children dying. I mean, is this about money? How does this level of corruption, this level of ignoring the science, this level of just allowing people to die, how does this get approved at the FDA? Is it just about money?
The conflict of interest is in the open, and it's extraordinary. The former FDA chair, Scott Gottlieb, he's on the Pfizer board, and he goes on CNBC every day and advises America on taking the vaccine. He personally profits. The commissioner after him, Stephen Hahn, who was over the FDA board when they approved the vaccines, he joined the venture capital firm that is funding Moderna. The Moderna patent is co-owned by the NIH. And now Rick Bright, who basically worked to block hydroxychloroquine and headed up the DARPA program, really funneled all the money to the vaccines. He's joined the Rockefeller Foundation that supports vaccine research. We have the CEOs of Pfizer and Moderna commonly coming on TV and advising America about taking vaccines. I mean, Americans should look at this gross conflict of interest and they should reject it. I mean, these people in no way should be on TV. The national media should have a check on conflict of interest. They can't give an unbiased assessment of risks and benefits. Do you know that CNN correspondent Sanjay Gupta and one of the other CNN non-medical correspondents, they went on Sesame Street and they were trying to entice children into taking the COVID-19 vaccines. And without fair balance, they weren't presenting the potential benefits and risks of the vaccine. That violates the U.S. Food and Drug Cosmetic Act, the Truth in Advertising Act. It violates the Landman Act. When drugs are advertised on TV, they must be presented in fair balance. They must. They can't be presented as an inducement or an enticement. Americans should be outraged in seeing these gross deviations from regulatory practice and good clinical practice.
Does Fauci financially benefit from the universal vaccination program and the supportive mandates that he's constantly hawking on TV?
I don't know that personally, but I'd point you to the book or point your listeners to the book by Robert F. Kennedy titled The Real Anthony Fauci. There's another good book that I think is a little tighter on the references and the connections, and that's Dr. Peter Breggin and Ginger Breggin, COVID-19 and the Global Predators, We Are the Prey. This is largely in the open. The entire operation of mass vaccination is in the open, completely full with all the conflicts of interest, all the flows of money that's occurring, and the amount of coercion that's really being placed on Americans. Americans have not wanted to take the vaccine since April. Rates of vaccination plummeted in the United States, and there were these gross inducements like donuts and hot dogs and beer. No one would take it. Then $1 million raffles, people wouldn't do it. College scholarships, they wouldn't do it. Even a trip to a brothel in Europe, a man wouldn't go for it because they knew they could lose their lives with the vaccine. Now the vaccines are being mandated and people are walking off the job, and rightly so. Do you know other mandated vaccines? We never protest. Meningococcal vaccine for college, nobody has a problem with it because it's safe and effective. Same thing with hepatitis B vaccine. So Americans are not anti-vaccine, but Americans don't like the idea that an experimental genetic vaccine, a gene transfer technology program, is racking up these record deaths and non-fatal events, and now it's being forced on them.
It's crazy. I want to go back to something you said at the beginning, because you've been a leader, of course. I mean, I would say you have saved thousands and thousands of lives across the United States with your early treatment program, something that the U.S. federal government should have followed your lead and pushed from the beginning, and they didn't. So I want to ask you some questions related to this. First of all, we're now into the Omicron variant. The vast majority of cases in the United States are not Delta anymore. They're Omicron. Do you expect there to be other variants?
It's impossible to tell. Omicron's been a very interesting outbreak. It's the most highly mutated form of the virus. It's less invasive. It arose in the fully vaccinated, so you can't blame the unvaccinated. It arose in fully vaccinated travelers on the border of Botswana. This is carefully chronicled. We know that it replicates 70 times faster than Delta. And remember, with Omicron, its enemy is not the human body. Its enemy is another strain. It basically outcompeted Delta because it can replicate faster. And then the human body forms immunity to Delta once they have Omicron. So it closes the immunologic door on Delta. So we're seeing an abrupt halt in Delta, which I can tell you as a treating doctor, that's welcome. Delta was a long, hard outbreak, and Delta affected younger people. It was a long illness, it was invasive, and it was severe. Good riddance. Omicron now is a much milder syndrome. The initial reports from the CDC indicated very little pulmonary involvement. It was 1 or 2 panic hospitalizations in the United States. That's it. The CDC does acknowledge that far more than 70% of people with Omicron are fully vaccinated. So Omicron is preying upon the fully vaccinated. It does impact those who are naturally immune as well. Now we have data from South Africa indicating that the inpatient mortality rate with Omicron is 1%. 1% of people sick enough to be in the hospital. I can tell you with any early treatment, the real mortality rate overall is going to be far less than 1%. So in my clinical practice, I'm seeing dozens and dozens of Omicron patients. They need largely just over-the-counter medicines. It's like a cold, and they get through it. Rarely patients will need some supportive prescription drugs. And I've had 1 or 2 seniors that have gotten the monoclonal antibody. And the key monoclonal antibody to ask for is sotorivimab, which is the GSK monoclonal antibody. It's the one that was designed to handle the mutant strains. And I was on Sean Hannity earlier this week, and I commented to Sean that that sotorivimab, the GSK product, that was EUA approved in May, was supposed to be on the shelf when we encountered a resistant strain. So here we are at the Battle of the Bulge. We have more cases than we've ever had before, and now our government says we're out of ammo. And I can tell you, doctors like myself are furious.
You should be, and so should the American people be at our politicians here. Now, Regarding Omicron, I mean, obviously the federal government is focusing on testing. The mainstream media is talking about this shortage of tests. I guess I don't quite see the point of testing for young, healthy people for Omicron, since it is maybe what I would call a glorified cold. But there is a question from some people. Are there negative tests, false negative tests happening on the at-home antigen tests? Meaning, can you test, it shows up negative when you actually still do have the Omicron variant?
When the tests are misused, we end up getting false positives and false negatives. The tests are only FDA cleared for people acutely symptomatic who have suspected COVID-19 respiratory illness, period. There should never be a test in someone who has no symptoms or someone who comes in with a broken leg or a broken hip. Never. The FDA has not cleared it. The CDC doesn't support it. The World Health doesn't support it. We are in an over-testing frenzy. And some of our laboratories are reporting more than 25% positivity rates. That basically tells you it's a completely useless exercise, that it's so ambiently common. We're not going to figure out who really has real disease, who doesn't. We should only be triaging the acutely sick, high-risk seniors. Many people are just not getting tests. There was a breakdown, by the way, a few days ago in California. There was a memo that came out in a healthcare system that said, listen, even if you're Omicron, even if you're COVID-19 positive, presumably Omicron, and your symptoms are mild, just return to work anyway. So, I mean, the whole system is broken down with Omicron. It looks like everybody's going to get it.
It's so crazy that some people are being fired. Some healthcare workers are being fired for being unvaccinated, while others who are fully vaccinated but actively have the Omicron variant of COVID-19 are being told to work. I mean, you can't make up that contradiction. Early treatment, you say that hundreds of thousands of lives could have been saved. How many people's lives, how many people could have been saved if the government had focused on early treatments that we knew about from the beginning?
In sworn testimony in November of 2020, I told America 50,000 lives, 50% of the lives could have been saved. And we had about 200,000 deaths at that point in time. So 100,000 could have been saved. But we got to Texas Senate testimony March 10th of 2021. I upgraded that to 85% of all the lives could have been saved. And as we sit here today with monoclonal antibodies, more intelligent treatment strategies, just a better handle on how to do this, I think 95% of all the lives lost could have been saved. And so people do attribute early treatment through the COVID-19 home treatment guides that came out by the Association of American Physicians and Surgeons and Frontline Critical Care Consortium, Truth for Health Foundation, American Frontline Doctors. Those were the hero organizations. People attribute those treatment programs to saving tens of millions of lives worldwide. And what we learned is it takes about 4 to 6 drugs, and it doesn't depend on any single drug. So we had doctors from South Africa and South America show us that we don't need hydroxychloroquine or ivermectin. We can use other drugs in an intelligent combination. The only way to really screw up COVID-19 in a high-risk senior is to deny them treatment.
Okay, talk to me about ivermectin and hydroxychloroquine. I know we're not even allowed to say these words on Twitter and on YouTube anymore, or else we'll get banned here. But I want to have a frank discussion with you about this, because a lot of Americans have taken these drugs. They've worked for a lot of Americans. There are a lot of studies actually that show that these drugs are effective. At this point, which of those two drugs is more effective against the Omicron variant?
We have now 300 supportive studies with hydroxychloroquine. And the very first meta-analysis, the randomized trials I published with Dr. Joe Ladapo, who's now the Surgeon General of Florida, the impact of hydroxychloroquine was about a 25% benefit. It wasn't large. Now, hydroxychloroquine was largely the first drug we had in year number 1, and it received all kinds of headwinds, FDA statements saying not to use hydroxychloroquine, falsified papers published, one in Lancet. I mean, there almost was a campaign to try to destroy hydroxychloroquine, a simple drug that we use for all kinds of conditions. That was year 1. Ivermectin, the data came on in year 2. Ivermectin, over 60 supportive studies, over 30 randomized trials, a bigger benefit with ivermectin, about a 70% improvement in the published studies, both randomized and observational. And it's a weight-based dosing, so we had to figure out the weight-based dosing. We were going too low in the dose initially. Now, most commonly, we use 400 or 600 micrograms per kilogram over several days. But ivermectin is a wonderful drug, and it was largely our workhorse in the second year of the pandemic. And shockingly, the U.S. FDA and the CDC have come out and said that it's only a horse dewormer, that the American Medical Association, which is a political action committee, is not even a treatment organization. It doesn't publish guidelines. The American Medical Association in early September announced a campaign to abolish the use of ivermectin. Like, what would the AMA care about ivermectin? Ivermectin's first line in Mexico, South America, India, first line in Japan. Why would the AMA take a stance like that? The Association of American Physicians and Surgeons actually fired a shot over to the AMA and said cease and desist. The AMA was actually participating in a misinformation campaign, as well as the head of the National Allergy and Immunology Branch. They can't go on TV and tell Americans that there's no data supporting ivermectin when in fact there is, broad support for the use of that drug.
And in addition to the studies that you cited, I mean, that's a lot of studies. That's a lot of data that shows that both hydroxychloroquine and ivermectin were effective. Dr. Fauci and subsequently the Biden administration and, their mouthpieces on CNN always reference just a couple of studies that show that hydroxychloroquine was dangerous, that it caused heart attacks, or that ivermectin wasn't effective. Can you tell the American people what were problematic or even rigged, if you believe that they were rigged studies that Fauci and his ilk are using to tell people not to take these drugs?
There's only 5 inpatient prospective randomized trials, and only 2 of them are placebo-controlled. And none of them have a single objective endpoint like death or rehospitalization. So all of them are contrived, and we actually have fewer than 500 patients in randomized placebo-controlled trials where we even draw any inferences. And in these late-stage trials, hydroxychloroquine was neutral on mortality. Neutral. It didn't cause harm, but it was neutral. And I can tell you clinically, if we start any drug that late, it's too late. It's not going to do anything. Patients die in the end of blood clots in the lungs. Hydroxychloroquine is not treatment for blood clots in the lungs. So it's these poorly designed, inadequate, underpowered trials that the FDA, the CDC, the NIH, and academia used to basically discard hydroxychloroquine altogether. But the community studies were much different. There's one by Mokhtari and colleagues from Iran, 28,000 individuals, a huge study. And they basically pick about 25% of their high-risk Iranian citizens. They give them a course of hydroxychloroquine plus some other drugs. It's associated with a large reduction in hospitalization and death. So it's been clear from the beginning, COVID-19 patients at home should get hydroxychloroquine or ivermectin if they're in high-risk situations. It's a base of the antiviral therapy. It's been my experience, though, if we give a monoclonal antibody, we probably can skip those. What I think is interesting is that we're heading into year 3. And year 3 of the pandemic is going to be the year of the Pfizer and Merck drugs. So the Pfizer drug is a combination of a novel kinase like 3 inhibitor and ritonavir, an older protease inhibitor. So we have 2 protease inhibitors. And then the Merck drug is a polymerase inhibitor, molnupiravir. The Pfizer drug looks good, over 80% reductions in hospitalization and deaths, low event rates in both groups. But the Merck drug is only about a 30% benefit. The million-dollar question is, if hydroxychloroquine was what carried us in year 1, ivermectin carries us in year 2. Will Pfizer and Merck carry us in year 3? And will doctors come off the sidelines and start treating COVID-19? I think year 3 is going to be very interesting.
Well, I asked our locals community, our VIPs here on the Liz Wheeler Show community on locals, if they had any questions for you, because everyone's so interested in what you have to say. And there are. It's funny that you brought that up, because that's one of the questions. These drugs that are coming out by Pfizer and Merck, are these drugs that are safe? Are they effective? And who should take them?
Yeah, I'll take the Pfizer drug first. I think it is safe as far as I can see. The event rates, safety event rates are about 20% in each group, active treatment and placebo. It's a short course therapy. Now, this combination has been out, Ridgeback Pharmaceuticals. It's been actually available, not clinically, but the drug supply was there, and the biochemical investigational product was there from the very beginning. So one of the questions is, why did they wait so long to bring a clinical trial forward? This could have been done in year 1, but it does look safe and effective. The Merck drug, molnupiravir, it only had about a 30% reduction in the primary endpoint. But there's a concern that the Merck drug, because it influences polymerases in somatic cells, that it may be oncogenic. And there's some papers written about the Merck drug potentially causing cancer. So, I think 5 days of treatment, I think very low risk of oncogenesis, but the Merck drug is not something we want to have people on for months to years. I think the Pfizer drug is going to be the mainline drug, but I really want to know is when patients develop COVID-19, they start to develop severe symptoms, are they finally going to call their doctor, and the doctor is going to jump into action and prescribe them the Pfizer drug and then the other drugs in combination? Why wouldn't they prescribe budesonide, which is shown in randomized trials to work, and prednisone and colchicine, shown in a large randomized trial? Tell them to take aspirin. Will doctors get in the game, or will the Pfizer drug basically be left on the sidelines unused, or will it be delayed? I think it's going to be very interesting.
Well, that's how people will be able to tell if it's politics or science that's being practiced
Right.
by
Right.
doctors. And that's another question from our locals community is there seems to be a very small minority of doctors, given how many doctors are in our country, who are following the science, who are allowing themselves to be skeptical of big pharma and big government. Why is it that so many doctors who claim to follow science, I mean, this is what they're practicing, the science of medicine, why is it that so few doctors are like you?
Many have said that there's a whole confluence of factors. Initially, it was fear. Many doctors were personally fearful of getting the virus themselves. Then they became comfortable in the new practice of telemedicine. And then there was regulatory capture. There was flows of money from the federal government that went to healthcare systems that said, listen, we'll give you COVID relief funding, but you've got to follow the FAQs. And the FAQs say follow the NIH guidelines. The NIH guidelines say specifically don't treat patients as an outpatient. Wait for them to get sick and come in the hospital. Follow the guidelines to promote mass vaccination at all costs. And so healthcare systems have been, in a sense, under regulatory capture. Many physicians work for the healthcare systems. They feel like they have nothing else they can do outside of follow the narrative. But these physicians must be getting very uncomfortable with, 21,000 people have lost their lives in the CDC VAERS system. How can they possibly tell the next patient that they should take the vaccine? Over 20,000 cases of myocarditis in these children. It looks very serious. The risk of blood clots, vaccine-induced thrombocytopenic purpura. We're seeing these patients pour into clinics and hospitals. Doctors have to be asking themselves, how much longer can they go along with this?
Yeah, I think it's caused a lot of the American people, myself included, to lose faith in the judgment or the advice from their healthcare providers, knowing that they've gotten this so wrong. It brings up the question, well, if you get this wrong, what else have you gotten wrong? What other information are you telling me that might not be true? And so that brings me to my final question. This again is from a VIP here on Locals. Is there one place that people can go to get accurate information about COVID? Because sometimes people have a hard time knowing what's true or what's not, or what's accurate information, what's a reliable source. Where do you recommend that people, everyday Americans, go to learn the truth about COVID, including not just in general, but including protocols?
Well, for the healthcare providers, let's say your husband, my colleagues, they should go to the American Association of Physicians and Surgeons. That's where all the continuing medical education courses are on how to treat COVID-19. That's where the protocols are. There's actually a list of treating physicians, and physicians can join that list, and it's promulgated. So aapsonline.org is a wonderful place to go. For patients and patient advocacy, they want to learn about treatments, they want the protocols, they want information on the vaccines, they can go to truthforhealth.org. Truthforhealth.org is Truth for Health Foundation. I'm the volunteer chief medical advisor. And then there are two really active treatment groups out there. So they not only provide information, but they got the protocols, and you can actually get medicines. And they are the Frontline Critical Care Consortium, flcc.net, and American Frontline Doctors, aflds.com. So, doctors have really stepped forward despite these headwinds in order to best take care of Americans. They can. I think a lot of these doctors are going to go down in history as heroes. They were really fighting tremendous headwinds that were denying Americans treatment in order to railroad them into mass vaccination.
And Dr. McCullough, I think you can count yourself as one of those heroes. You are a wealth of information and knowledge. Thank you for taking the time to sit down with me today. Thank you for everything that you're doing, taking leadership on this issue in our country. I really appreciate it. So do the American people.